The GOP tax plan will blow a $1 trillion hole in the U.S. budget. Almost every independent analysis of the tax legislation says so. But Republicans say that much-needed welfare reform will help pay for it. How? In part by mandating work requirements on all able-bodied Americans who rely on the government safety net to survive. Well, for starters, only 7% of federal spending goes to programs like food stamps, temporary assistance, and Medicaid. Even so, there isn't much fat to cut out of these programs because most of their recipients already work. Take Medicaid, for example, which gets more funding than all other support programs combined. It subsidizes health coverage for 74 million low-income Americans and others who qualify because of a covered disability. Researchers at the University of Michigan found that close to half of Michigan enrollees held jobs in 2016, while another 22% did not because they had qualifying disabilities or were in school or retired. But 28% of Michigan enrollees were technically out of work and so should be ripe for a GOP work requirement. Except that figure includes a vast majority of beneficiaries with chronic mental or physical health conditions that could prevent them from holding a job. And those findings have been replicated in surveys conducted nationwide. The Kaiser Family Foundation identified 14% of all Medicaid enrollees nationwide, 10 million, that could be affected by a mandatory work order. And of those 10 million, Kaiser said most had legitimate reasons to be out of work. But about 300,000 of them, about 0.4% of all Medicaid recipients, could be pushed off of Medicaid under a GOP work mandate. Even the conservative Heritage Foundation admits work requirements for Medicaid wouldn't raise a significant amount of money. Look, if Republicans want to reform our public assistance, let's have that debate. But to do so on the false premise of saving a buck, or worse, paying for a tax plan that benefits the rich off the backs of the poor, that's just ugly.